the pandemic for the first time in more than 2 months. The World Health Organization has consistently praised China's handling.
They're rapidly finding these cases, rapidly containing them, using the principles that China employed.
President Donald Trump also applauding the Chinese efforts just a few weeks ago.
I know this. President Xi loves the people of China. He loves his country, and he's doing a very good job with a very, very tough situation.
But as numbers in the U.S. continue to rise, so does the skepticism over just how reliable China's numbers are and how transparent it's been with its data.
The reality is that we could have been better off if China had been more forthcoming.
Video shows Wuhan's grieving residents collecting the remains of their loved ones. Daishin, a leading Chinese business publication, claimed there were thousands more urns delivered than the official coronavirus death toll. But worth pointing out, 2 days after the lockdown, Wuhan officials halted all funeral services in a city of 11+ million. So it is plausible the urns are also used for those who died from something other than coronavirus. But CNN's early reporting inside Wuhan back in January suggested the numbers were not adding up when compared with the stories from the front lines, in part because of something that now many countries are challenged with, a shortage of tests.
It's really difficult, and it's really emotional for me.
Dora Zhang told us it took 4 days for her uncle to get tested. The results also delayed.
I don't think it's because they really want to control the numbers, but I think it's more about the capacity.
Kyle Hui told us by phone his mother died in mid-January in Wuhan. She never had a nucleic acid test, he told us. Her cause of death was officially listed as severe pneumonia. But during her treatment, the doctor said it was very likely that she had coronavirus. And yet she was not a confirmed case and hence could not be counted. China says they first detected the virus on December 12th at this Wuhan seafood market. But they did not shut it down until January 1st. And during that 3-week period, the people of Wuhan continued on with their normal lives as local government officials censored so-called rumors about the then mysterious illness and silenced whistleblowers like Dr. Li Wenliang, who tried to sound the alarm. He was reprimanded by police, later died from the virus, and now the Chinese government is hailing him a hero. The country's National Health Commission officially began releasing daily figures on January 21st, almost 6 weeks after the first detection. Within days, they had reported a total of 1,052 confirmed cases in Hubei province alone. But almost immediately, health experts at the University of Hong Kong challenged those figures, believing the real number to be 40 times that just in the city of Wuhan. One possible reason? China, in the early days, not allowing international experts in the country. For weeks, Health and Human Services Secretary Alex Azar said the CDC was ready to deploy, hoping to get a handle on the problem before it got out of control.
We're ready to go.
But a World Health Organization team did not land in China until February 10th. Again, almost 2 months after the first detection. And now, 2 months after that, experts still doubt China's official count.
The Chinese government data is definitely not transparent. The local government has an incentive to underreport the cases to boost the appearance of their good performance. We really don't have the information and evidence needed to be more confident about the Chinese government's number.
It's a claim the Chinese government has repeatedly shot down.
The fact is that China has always been open, transparent, and responsible on informing the World Health Organization and the international community.
China's health officials also heavily stressed the recovery rate, pointing out that of the about 82,000 reportedly infected here in China, more than 76,000 have survived this illness. And just this week, after some pressure, health officials began releasing data on asymptomatic cases. The new concern here, as lockdown restrictions ease, both people without symptoms and those infected coming in from other countries may expose others to the virus and lead to a second wave of infections here, the place where it all began. David Culver, CNN, Shanghai.